Yeah, very good evening, all of you. We are here with another very informative session. We have Mr. Jahan Pester Jamas, founder Bombay Ham Company, and we are again thankful to Boheco Bombay Ham Company for ensuring these kind of sessions are going on our platform, because this is very crucial and important to spread knowledge and information. In fact, today morning we all woke up with a great news in all the leading newspapers that Thailand is the first country in Asia legalized medical cannabis in a systematic way. They have done this. Still, they are not that much open to recreational, which is fine, which we respect as per the country's policies and all. But at least they are now more open to the medical cannabis and medical usage of this wonderful plant. So that is a great news, and hope Indian counterparts also will take a note and maybe move forward and progressively and allow some more like aspects in this regard with this particular plant. And second, congratulations to Boeco for a nice and wonderful makeover of your branding, of your overall look and feel of the products. I really liked personally, to be very frank, an excellent effort by the entire team. So it's very different. It's a very like different look and feel of the products. I request all of you to visit the site of Boheco. I think you have changed the site domain as well, so maybe you can brief
Correct,
on that as well,
correct.
Jahan. So please visit Boeco site and please have a look of the new branding of the products. And there are, I think, several launches are also planned in this year. I think there are a couple of launches you are planning for next month as well, as per my update. So maybe we can have that information also in the session today. And it will be a very crucial session today because we are specifically discussing upon the chemotherapy induced nausea and vomiting, and this is a very crucial and very critical issue which we all need to understand. Still, we are not having that much of liberty as far as Indian continent in Indian country is concerned, using medical cannabis in a form of those formulations which are having a bit high THC and like the cancer treatment and the cancer elimination from the body requires that. But whatever the existing products we are having, they are having excellent results in terms of managing the side effects. Today we'll be talking on that how to manage nausea and vomiting, and there are so many patients in our clinic also we are seeing that they are getting benefited, especially the side effects which are related to nausea, vomiting, and many other, and especially the pain management also. And somehow we have seen, if we are recommending and prescribing them and in some longer duration they are taking, it is also helping them out. However, we are not supposed to claim that on these kind of platforms, but as per our clinical experience, at least as a clinician we can say that we are seeing that the longevity, the overall control in terms of the cancer is concerned, and the episodes of recurrence and many other aspects are also getting improved. However, more research and more data should be there on Indian population, and I think Boheco is already doing some footsteps they have taken. I think they are already in process of doing some kind of research with Tata Memorial Hospital and other leading cancer organizations and hospitals in our country, which maybe Jahan will update us, because this specific session is related to the cancer patients and the management of these issues in the cancer patient. Will Dr. Chitranshu will be presenting certain data and certain case studies today. I'm very happy to introduce him and to have him in this session. He is my junior in the college, but very encouraging and motivating to see doctors like him taking medical cannabis so seriously and getting involved with this passion and with this area of interest. So that is very motivating and very pleased to have doctors like him on our platform, because that was the whole idea when we started this. And in fact, when we started, if Jahan, you remember, we struggled to have these kind of doctors to get involved in these kind of sessions. But now, gradually, the number is increasing, and it's a bit easy to at least get some doctors who are working and who are taking this field seriously. So it's very much encouraging, and we are very much pleased to have Dr. Chitranshu today on this session. So first of all, I request Mr. Jahan Peston Jamas to please have an introduction about Bombay Hem Company. Although your company does not need any introduction now on our platform, almost all the viewers are aware about you still. And please also give some insights in terms of what kind of efforts, what kind of research activities, what kind of action items you people have taken as far as the side effects management or any kind of management in the cancer patients in the oncology segment, as far as Bohiko is concerned, and then maybe we can proceed to the technical session from Dr. Chitranshu as well. And again, thank you all of you for joining. We request all of you to please post your queries, questions, comments as we will proceed with this session. And after the presentation, Dr. Chitranshu and Jahan will definitely love to answer that and take it forward. So over to you, Jahan. Thank you.
Thank you so much, Dr. Piyush, and thank you once again for a kind introduction. Just a matter of brief introduction about myself and Bohiko. My name is Jahan Pasanjamas, as Dr. Piyush mentioned. I'm a co-founder and chief strategy officer at Bombay Hemp Company, India's first industrial and medical hemp cannabis company, born almost 9.5, 10 years ago. Specifically touching upon what Dr. Piyush mentioned, a lot of our research efforts are in the domain of cancer and understanding how cannabis would work in different therapeutic domains. For that, we have partnerships with Tata Memorial Hospital for several clinical studies. We've just commenced a couple of phase 1 studies. A few more observational studies are due, right from stage 2 onwards up to palliative care, and even studying the effect of cancer of cannabis-based medicines with certain mg of CBD and THC for its symptomatic relief for sleep, anxiety, as well as nausea and vomiting post chemotherapy. So it's a great pleasure to be here, and I'd love to take a quick minute to introduce Dr. Chitranshu Saxena, our honorable speaker, as part of our virtual CME for today. So Dr. Chitranshu Saxena is an associate professor in the Department of Medical Toxicology at Chaudhry Charan Singh University in Meerut. He has previously studied his BA MS from HNB Garwal University and has also done his post graduation and his PhD in forensic and medical toxicology. So comes with a wide variety of expertise and understanding around the efficacy as well as the toxicity of how cannabis based medicines work. He's specialized in critical health conditions like cancer, autoimmune diseases, Parkinson's disease, diabetes, and Alzheimer's, and is trained for medical cannabis protocols that help people with life threatening chronic diseases and helps significantly improve the QOL, or the quality of life, during conventional treatment. He has also attended many national and international seminars and conferences as well as programs. He has 22 research publications total to his name in many national and international journals, with 3 books published from Germany and London, respectively. So, without any further delay, Dr. Chitranshu sir, I'd love to hand over to you for an insightful session on how Vijaya leaf extract has worked and has shown use case efficacy in CINB settings as well. So, over to you, sir.
Thank you, Jahan, for the introduction. And firstly, I would like to thank Dr. Piyush to give the opportunity to spread this knowledge of Vijaya to all my fellow doctors. See, one thing we have to understand very basically, like Vijaya is not new to Ayurveda. We have been using Vijaya for many years since past time, but this the whole concept of using Vijaya is to be re-evaluated. Like people are having the social taboo of using this Vijaya leaves. So we have to make them understand that this is not a new plant. We have been using it for many years, and we have its reference in our Ayurvedic classics. This is not new, but the application the acharyas has given, we have to rename them. We have to give a new nomenclature for that diseases, and we have to show them the result. We have to tell them the result of this Vijaya. This is a very miraculous medicine which has been mentioned in Atharved in the 5 sacred plants. The one of them is the Vijaya. So we have to make them understand this Vijaya is not new. It is the oldest medicine that is available to mankind. We have many references from all over the world. We have from different civilization. We have seen Vijaya has been used in many of the ailments. So this is not a new plant. This is a very old and a very sacred and a well-defined, properly described medicine in the Vedas, in the Ayurveda. in every aspect of Ayurveda. They have given they have explained it very well. So first of all, my point is, do not treat this medicine as a new medicine. This is one of the oldest medicine available for humankind. Second point that comes to the mind is the application here. Now specifically today we are talking about chemotherapy induced nausea vomiting. See, chemotherapy is a very new technique that has been developed, means last 100 or 200 years before it has been developed. So this chemotherapy is a very new thing for human being. Because of this chemotherapy, there is a very significant deleterious effect that is known as chemotherapy induced nausea vomiting. These chemotherapeutic agents, they induce this nausea and vomiting in the patient. There are many of the other complications, but major one are the nausea and vomiting. Before coming to the slides, I would like to give a brief introduction of cannabis in Ayurveda. As per Ayurveda, this Vijaya, it consists of two varieties. The one is the cannabis sativa and one is the cannabis indica. In India, we have both the varieties. The whole leaf extract is obtained from both the varieties. It is very easy to differentiate between both the varieties because one is having a broader leaf and one is having a very sharp, pinpointed leaf. So we can differentiate it very easily. So, secondly, coming to the point, this as per Ayurveda, Vijaya have many medicinal properties, like it have a bitter taste, it has a lagu gun, tikshna gun, vivai gun. See, as per Ayurveda, what we have told is it is having vivai gun. Vivai gun is that property by which the medicine get spreaded within the body very quickly, and after that it will give the medicinal properties. It will give the medicinal result within the body. So vivai gun is very important. It is having a vipak of katu vipak, and it undergoes pungent taste after digestion. These are the terminology of Ayurveda. We have to understand it is having a ushna potency. So we have to understand these things. Keeping in mind, we have to treat the patient if Vijaya is having these type of properties, and in which disorder we can use, in which disorder we can't use. So coming back to the slide, sir, can I move back to the first slide? Yeah, coming back to the slide, this chemotherapy induced nausea, vomiting. So yes, thank you. The chemotherapy induced nausea, vomiting remains a significant cause of morbidity in oncology patients despite the best current anti-emetic prophylaxis. See, there are many of the guidelines provided for the cancer patient against CINV, but the main concern of this chemotherapy is there is nausea and vomiting. Patient, due to this chemotherapy agent, patient feel very nauseated, very they have many episodes of vomiting. So there are guidelines which says that 5-HT receptor agonist and dexamethasone is to be used, or NK1 agonist should be used to eradicate this possibility of nausea and vomiting. These are used as antiemetic prophylaxis for moderate and high emetic risk. But the thing is, these are not up to mark. They only have the efficacy of 53%. There was a article in the web and I was reading. They were showing that there was a efficacy of 45 to 53%, that it controlled this condition of CINV, chemotherapy induced nausea vomiting. So what to do? The question arises, what to do? So there is a alternative therapy of this Vijaya leaf extract. We can use Vijaya leaf extract. Many of the studies has not been done, but so far there is some evidences and many case reports stating that Vijaya leaf extract is capable in controlling CINV, the chemotherapy induced nausea vomiting. So, our first goal is just to relieve the patient from this nausea and vomiting condition. We are not here to treat, we are just here to eradicate the possibility of nausea and vomiting in chemotherapy patient, undergoing chemotherapy patients. So it has worked wonderful in the patient of CINV. It's the next slide. Devesh, next slide. Yeah, thank you. The mechanism of delayed nausea and vomiting is incompletely understood, but may involve may involve non-serotonergic receptor, including the cannabinoid CB1 receptor. See, here comes the main point. Key CINV may include the cannabinoid CB1 receptor involvement. So when we see there can be involvement of CB1 receptor, then we have to use Vijaya leaf extract. So on using Vijaya leaf extract, we give the with the help of the entourage effect, and we just we just bring the equilibrium to the CB1 receptor, and we help the patient of chemotherapy to eradicate nausea and vomiting. There are number of factors that plays a role in considering the therapeutic option for controlling CINV, including the tolerability of anti-emetic therapy, the patient setting, that is the inpatient or the outpatient setting, the patient preference, means the oral route administration or the IV administration. Many of the other factors are important, but in total, we can come to a point: if a person is undergoing a chemotherapy and we are giving him antiemetics, if it works, okay, fine, then it is okay. And if it is not working, then what we can do? We can prescribe the patient with Vijaya leaf extract, and it will help them out. It will reduce the possibility of nausea and vomiting in the patient. Not so much studies has been done, but the evidences has been shown. So next slide. So when coming to the case study, like we are not here to explore the theoretical part, but we are here to see the beneficial part. We are here to understand the therapeutic part of this cannabis. So here I am presenting a case of CINV in the patient of breast carcinoma. So there was a female patient of 55 years old, post-menopausal female, presented with a complaint of lump in the right breast. The bilateral sonomammography was done at 26/3/2021, suggesting of hyperdense mass lesion with irregular infiltrating margins in the central part of the right breast. FNAC of the breast lump suggested of a ductal carcinoma. Next slide. She underwent modified radical mastectomy on 9/4/2021 under GA. Chemotherapy was planned for 6 cycles. Patient was having the comorbidity of diabetes mellitus type 2 and hypertension, for which the modern medication is continued along chemotherapy. So when we come to the point on treating the patient, we have to also see the comorbidity factor, the other factor, the prakriti of the patient, the sthiti of the cost. We have to assess each and everything. After that, after assessment of that, only we can prescribe how much amount of cannabis can be given to the patient. Next slide, sir. So this was the oral medication. I In this specific patient, I planned a oral Vijaya tincture, for which the what I did is I started with a very low dose, and then I went on to a higher dose. So I started with the oral tincture, the extract of Vijaya leaf of 3000 mg. I started with a one drop at night. Then gradually moved to the one drop in the evening, one drop in the morning, and then I again increases the dose after seeing the result. When I did a one drop in the morning and two drop in the night, then I again increases the, so slowly I increase the dose of the patient as per the need, as per the cycle, and seeing the result. If we are not getting a result on one drop, we will go to the two drop. We are not seeing on two drop, we will go to the three drop. There is no general specification that we have to start with 5 drops or 10 drops of 20 drops. We have to start with one drop. We have to see the changes, the complaints of the patient, and what they are complaining. Is it giving benefit? Is it not giving benefit? If not giving benefit, we have to slowly and gradually increase the dose, because the main fundamental thing we have to understand about Vijaya extract is we have to slowly increase the dose. The slow and the gradual increment in dose is the basic principle for giving cannabis extract leaf, cannabis extract to the patient. We can't go straight to the 5 drop or 10 drop. So next slide. The observation what I saw in the patient, the observation what I saw was during chemotherapy after starting this Vijaya leaf for the cannabis treatment, the patient did not suffer from diarrhea. Previously, she was suffering from diarrhea, but now she was not suffering from diarrhea. Her appetite became normal, and the weakness gradually reduced. The cramps and the leg pain reduces, and she retained her physical fitness and mental well-being. This is the very main point. We not only have to eradicate the disease portion, also we have to give the patient the physical fitness and the mental well-being. Like coming back to the basics of the Ayurveda, the what we have, the main aim of Ayurveda is swasthasya swasthya rakshanam aturasya vikar prashpanam. We have to not only provide the treatment to the diseased person, also we have to provide the health to the healthy and the health to the diseased person. So coming to this point again, she regained her physical fitness and mental well-being. This Vijaya leaf extract is very good in maintaining the mental health well-being of the patient. All the cycles of chemotherapy was well tolerated by the patient, and she completed the prescribed schedule of chemotherapy with very less side effects. See, coming to the point is, if we on comparison, there are many of the articles in which the scientists, what they have done is they have grouped the patient in some, in one group they are giving only the modern medication, the antiemetics guided as per the guided guidelines of the modern practices. They are giving only the antiemetic, but on the other hand they are on the other patient they are using antiemetics along with their Vijaya leaf extract. So what they found out was the patient having the taking of Vijaya leaf extract was able to tolerate well the chemotherapy. So likewise, we saw the result in this case study. Like all the cycles of chemotherapy was well tolerated, because when this patient approached to me, she was undergoing the second chemotherapy cycle. So I started cannabis from the second chemotherapy. After completion of second chemotherapy, I gave her the cannabis for the two cycles. There was a very remarkable difference. In the first cycle, she was having leg pain, she was having cramp, her appetite was reduced, she was suffering from diarrhea, she was feeling very nauseated, and she even had a 6 episodes of vomiting. So after starting this Vijaya leaf extract, there was very much or reduced symptoms of this CINV, and she was able to tolerate the cycle well. After completion of 6 cycles, there were very encouraging result observed with the negligible side effects, improvement in general health condition of the patient, particularly the pain, which was very negligible after this cannabis treatment or the Vijaya leaf extract treatment. So this is very important observation. What we see was she was suffering from pain previously, and after giving Vijayleaf extract, she was not suffering from pain. Along with that, the nausea and vomiting symptoms were reduced. Along with that, the cramps in the legs were reduced. She was able to gain her general health condition very well. Her mental well-being was seen. So overall, everything was established quite well in the patient. So next slide. This is a scanner to download the paper. If anybody want to scan it, you can just scan the paper. I have published this study in the articles in the journal, and you can scan it. So next slide. This is the second case. This is the second case is still undergoing. The I'm not making any type of observations or claim to anybody or claim regarding cannabis that it help in reduction of the cancer, but the thing what I'm seeing is I'm just telling it out here. This is a patient. This is the scan of a patient. What she contacted me on her second cycle. She contacted me and she was suffering from nausea and vomiting. She just contacted me, sir. My mother is undergoing chemotherapy and she is suffering from nausea and vomiting. Can you give something? Then I prescribe her the Vijay leaf extract, and last week she has completed her sixth cycle of chemotherapy, and in between the doctor get a PET scan of the patient, and you can see this is the patient of gallbladder carcinoma, and we can see there is a decrease in size of heterogeneously enhanced mass with central necrosis seen involving the wall of the gallbladder infiltrating the adjacent liver parenchyma, now measuring 6 by 5.5 centimeter, previously 9 by 8.3 centimeter. So I can't make a claim that the cannabis has done this work, because both the therapies, the cannabis, the Vijay extract, along with the chemotherapy, is being given to the patient. So we have seen this. This is a live demonstration that there is reduction in the mass. The previously it was 9 by 8.3 centimeter. Presently it is 6 by 5.5 centimeter. So coming to the conclusion that both chemotherapy along with cannabis or the Vijay leaf extract, they help in reduction of the cancer mass. I can't. We can say it like this also. Ki cannabis nullifies the deleterious effect of chemotherapy, and chemotherapy does its works. The coming to the point, ki cannabis Vijay leaf extract helps patient to withhold the deleterious effect of chemotherapy, and chemotherapy in itself is doing the work against the cancer cell. Okay, sir, next slide. See, here you can see they have given the schedule for 6 cycles, and Gembin and Oxytan are the chemotherapeutic agent that have been used on the patient. So these both are working against the carcinoma of the gallbladder. And what I am trying to do is I am giving Vijay leaf extract to withhold or withstand the negative effect of chemotherapy in the patient. Okay, there is also a third case study that I have not mentioned here. The patient is suffering from adenocarcinoma of lungs. So what I have done is, the patient was previously not able to sit properly. She was very weak, generally very weak. And what I did is she contacted me ki, I'm undergoing chemotherapy and I'm not able to sit, I'm not able to do my work properly. What can I do? Can you help me? Manka, yes, we can try something. Then what I did is I give for the lung carcinoma. What we used to do is we tried to provide the cannabis directly to the area. Then I prescribed her the smokable format of cannabis. The only result which I have to which I would like to mention out here was previously she was not able to sit properly, but with the help of smokable cannabis she was able to gain her general well-being. She was able to sit, she was able to walk without any help, she was able to do her work just after undergoing the therapy for 2 weeks. After 2 weeks of taking Vijaya leaf extract, Vijaya leaf smokable format, she was able to walk properly. She was able to do her work properly. She was very underweight because of chemotherapy. She was able to gain some weight, not exactly very much weight, but some weight. But she was having a very good well-being. That what I am trying to say is our major aim is not only to eradicate the disease but also to provide the physical and the mental well-being to the patient. So I gave a smokable format of Vijaya leaves, and she was able to do her work herself. So, so next slide. So here I conclude my things. So last the point takers, what I would like you all to have is Vijaya. What it does is it nullifies the effect, the delirious effect of chemotherapy. Also, Vijaya helps in physical and the mental well-being of the patient. Also, it provide a quality of life to the oncology patient, the patient which are undergoing chemotherapy. In which, like, we have to understand the chemotherapy in itself is very I would not like to say dangerous. I would like to say it's a very uh, 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 it's a very we can use the word not good for the patient. This chemotherapy is not good for the patient. It disturbs all the equilibrium of the body. So what we are trying to do is with the Vijaya leaf extract, we are trying to maintain the equilibrium of the patient. We are trying to maintain the internal environment of the patient with with the Vijaya leaf extract. We are trying to provide the mental being, because see, the patient, when a doctor breaks the news of like you are suffering from such and such type of cancer, they undergoes the stage of depression. So what we have to do is we have to pull them out of the stage of depression. First thing what we have to do as a doctor, so we have to assure them ki this, like, there is a cancer and we can regain we can try to regain your health with the help of chemotherapy and other agent. You don't have to worry that much about it. Yeah, there is cancer, but you have to be strong. You have to face a long journey of this chemotherapy. So we have to reassure the patient. The first thing is that the like patient, as soon as they listen their news of being being suffering from cancer, they undergo the state of depression. So Vijaya leaf extract help them to come out of this stage of depression. Secondly, chemotherapy in itself affects the body. It affects the carcinogenic agents that are creating the cancerous cells in the body. Along with that, it also affects some healthy tissues. So what we have to maintain is maintain the physical well-being. The other general well-being of the patient is very key point to be note, and we have to maintain that also. So this Vijaya leaf has extract help in mental well-being, physical well-being, help in regaining of the weight of the patient, help in anorexia within the patient. Like patient is not able to eat, they are not having the feeling of getting uh, this they are not having a mood to eat the food, they are not hungry, they are not feeling hungry. So this Vijaya leaf extract helps. This is my presentation. Just I am trying to give an idea. The Vijaya leaf helps in chemotherapy induced nausea vomiting. It also not only helps the patient physically but also mentally. It also helps. So I have seen many of the patients, they are suffering from cancers, they are undergoing chemotherapy, I am prescribing them visual leaves, and they crosses their all the cycles uh, very easily and very calmly without having any of the side effect of this nausea and vomiting. That concludes my session. Thanks.
Thank you so much, Dr. Chitranshu. So I think this was a wonderful session, and it particularly is very close, hits close to home for us at Bohico, because even from our side, we've had hundreds of patients who have been at different stages of cancer who have used our Vijaya leaf extract pain management and pain management strong formulations to actually help manage the symptomatic relief. And as you mentioned, so on occasion, an Emerset type medicine will only get you so far in antiemetic activity. 53% you said, if I'm not mistaken. The rest of the gap still needs to be covered within the domain of chemotherapy and actually dealing with the side effects on the after effects of it. As you mentioned, that chemo is a carpet bombing in a certain way as well in many manners. And I think I'll just quickly like to touch upon two studies I'd come across. One was as we say that historically India may we have come to know, we have known this knowledge, and now we are taking this into the future of knowledge with Ayurveda. But what's very interesting is even globally at a clinical study level, I remember there's two studies. One is from the University of Sao Paulo and one is from the University of Barcelona. First one was a systematic review and a meta-analysis of all papers with cannabis-based medicines for CINB. I think there was 12,700 papers they went through. Only 30 matched the inclusion criteria, and it was clear. They had undertaken 5 meta-analysis, made it very clear there is considerable anti-emetic activity in different types of cannabis. It can be pure THC like dronabinol, can be Sativex, THC CBD 1:1 जो Vijaya leaf extract में होता है in India, if we were to give a biosimilar equivalent. And that really speaks to the volume of how research in the West has only started in the last 20 years. But India, we have had this knowledge. Now as you are recording this in clinical cases, it becomes important to document such studies and information. And the second one I remember from University of Barcelona was using Sativex, where I think it was a phase 1A, or no, it was phase 2A and 2B, using for efficacy and safety using the 1:1 extract in CINB, and the results are fantastic. And I remember that paper got published. They got a great response on it. I think it was a small study. It was only it was randomized. There were 9 on cannabis medicines, 9 on placebo. Only one patient dropped out with adverse effects in the CBM arm, and the rest had almost complete relief from nausea and vomiting through their sort of chemotherapy sessions, which speaks exactly to what you have mentioned, Dr. Chitranshu, that this type of knowledge becomes important to conserve. And so I think before
Yes,
we
yes.
head out, yes, sir, tell me,
One
tell
thing,
me, please.
one thing more, sir. I came across a patient of this chemotherapy-induced nausea, vomiting, and as soon as I prescribed this cannabis to the patient, the symptom increases. Then I have to suddenly stop the cannabis. So it is very essential to see what we whom we have to give and whom we have not to give. The type of chemotherapeutic agent they are using, it also depends on that. The interaction with them also depends. Secondly, quality of product also depend. And thirdly, we have to see there should be a proper, in India we there is a limitation that we can't use extract, we can't use isolate, but the whole visual abstract should be of 1:1. It works very well in CINV. 1:1 is very important. This is the key point. What I would like to say.
No, very great. A very, very important point, Dr. Chitranshu. I think, the 1:1 full spectrum nature makes a very big difference in this. So I think we have two
Yes.
questions from one of our regular viewers on Dr. Piyush's channel, Indian Vedyas. Ma'am had two questions. Number one, what is the recommended dosage? And number two, what is the
Uh,
correct stage of cancer to start cannabis? Which I think is related to somewhat to what you had mentioned earlier, sir. So if you'd like to just
yes, yes.
cover that.
Coming to the dose, we have to see the condition of the patient as per Ayurveda. After doing the Dashvit Pariksha and everything, we have to see how is the cost of the patient, and how's the general ability of the patient. We have to start this before starting this visual leaf extract. We have to see all that, and the key point to start cannabis or the visual leaf extract therapy is go with a low dose, go slow, and go low. The important thing is that we have to start with a low dose. Like I will give you an example. You started with a low dose of 1 drop of this visual leaf extract to the patient, and you started a 1 drop, and you went on for 5 days, and you are after 5 days you ask, is there any changes? The patient said no, there is not changes. Then again you increase the dose, then again you increase the dose. It depends on that. Secondly, when to start cannabis in the cases of cancer, as soon as possible. As per my point of view, as soon as possible you can start cannabis. Like, we have evidences, we have studies that claim ki cannabis have anti-carcinogenic effect. They help in prevention of cancer, in the manufacturing of cancerous cell. So as soon as you get the report ki the patient is suffering from cancer, you can start your cannabis.
Thank you so
I
much for that,
think
sir.
I think these answer satisfies the question of the viewer.
Definitely, sir. Definitely. I think this very much helps. And I think ma'am had another question regarding about whether this helps in conditions like herpes, which I'm not sure if in the pain of herpes, I'm not sure if that is something within your patient profile. And if it isn't, I'll be happy to shed some light on the global literature around this, if in case you require.
In the cases of herpes, what I have seen is it help in the pain aspect of the, like, it is cannabis helps in the pain. So I think I haven't came across any of the patient of herpes, because I don't take the patient of herpes. I don't treat the patient of herpes. But what I think is it helps in the pain aspect of the herpes. It reduces the pain. It should reduce the pain.
So I think also, so I may be able to shed some light from our anecdotal and case information, ma'am, and this is for basically for at least from our case point of view, we've had patients who have had HIV and other STDs as well at a little more advanced stage where they've had significant pain, who have been patients who have been prescribed our pain management strong products, or now called Peace and Peace and Combat, where they've had great relief from pain, symptomatic relief. From a herpes point of view, a lot more information is available globally. The global clinical studies go all the way back to 1995 using something called dronabinol, which is a very high THC, synthetic THC version in a capsule in the United States, where it was used on sort of anorexia in patients with HIV, as well as with several patients with advanced stages of herpes in considerable pain, where they did see symptomatic relief. So there is global clinical information that does validate that as well. Wonderful. So I think this is the session for today. Um, I think essentially Dr. Chitranshu has had to log off due to some technical issues at his end. But I'd like to wrap up the session and thank everyone for their time. Yes, I think we have Dr. Chitranshu here as well. So I think we
Yeah,
have one
yeah,
last.
internet problem.
No problem. No problem. Yeah, I think we have. I think just for to wrap up the session, I thought I'll say a big thank you from our side at Bombay Hemp Company and Bohico. I wish to offer you all our thanks for sharing your case and clinical information, on a public platform, actually creating awareness amongst different practitioners, different patient communities, and different parts of the society, which becomes very important to build the ecosystem for how Vijaya is used in a medical and therapeutic setting, sir.
Sorry, can you please repeat? I wasn't able to hear.
No problem, sir. No problem. I just wanted to thank you on our behalf for a
Okay, okay,
great
okay, okay, okay. Thank you.
and looking
Yeah.
forward to many such interactive sessions, very interesting sessions going forward as well, sir.
Okay. Thank you. Thank you. Same here, sir. Please, thank you from my side to provide the platform so that I can educate other doctors, my fellow doctors. And I try to, what I try always try to do is whatever I have achieved, I just try to share with you all. And these type of platform provided by Indian ventures are very important, and we can learn very much from them. I also request my fellow doctors to contact Mr. Dr. Piyush if they want to communicate, or if they want to share any information or the case study they have been doing. So I would also be very lucky to learn from them. Thank you, Jahan, and thank you, Piyush boss, for providing the opportunity and the platform to just me to speak.
Definitely. Thank you so much once again, Dr. Chitranshu. And again, as you mentioned, thank you, Dr. Piyush and team at Indian Vedyas for hosting us on the platform. Looking forward to having Dr. Chitranshu for follow-up discussions where we dive deeper into other aspects of how Vijaya extract would work. And looking forward to interacting and connecting online and offline in the future as well. So
Thank you.
thank you
Thank
so
you, sir.
Thank you. Thank you.
thank you so much, David. Thank you, everyone. Take care.
Okay. Bye, sir.